So my name is Brent Goodman. I'm a neurologist at the Mayo Clinic here in Arizona. I'm director of autonomic lab and clinic here. And the topic of my presentation today was POTS, which stands for Postural Tachycardia Syndrome. So POTS is an autonomic disorder that is common. It affects typically the young. It seems to affect women much more commonly than men, at least 5-to-1 female to male ratio. We don't know exactly how common POTS is. It's a condition that oftentimes is difficult to diagnose, and there may be considerable delay in establishing a diagnosis of POTS, and some people may not get diagnosed with POTS at all. So knowing exactly how prevalent it is has been a challenge. POTS is a condition that we believe affects the autonomic nervous system. So patients present with a number of different symptoms. Those can include lightheadedness. Patients can report a history of fainting or feeling like they're going to pass out. Patients oftentimes will report a history of feeling fatigued. Many of these symptoms will not uncommonly begin after an infection. So about 40 to 50% of people will report a history of some sort of infection prior to symptoms beginning. POTS patients, though, oftentimes have a number of other symptoms that accompany those symptoms of lightheadedness and feeling faint. So other symptoms can include GI symptoms. So nausea is a common symptom. Patients may report bloating, abdominal pain, constipation, diarrhea, feeling like they fill up too quickly when they're eating a meal. So those GI symptoms are quite common in POTS patients and can be the source of a lot of difficulty for patients, and important to recognize and appropriately evaluate and hopefully treat those symptoms as best as possible. Other symptoms in POTS patients can include difficulties with sleeping. Some patients will have difficulties with urination. They may report difficulties regulating body temperature. Many people with POTS report difficulties with thinking, so patients will often report this as being brain fog, not thinking well, not being able to use language well. These are all common symptoms that we see in POTS patients. POTS is a diagnosis that is actually fairly easy to establish once the symptoms are recognized. So there are diagnostic criteria for POTS. So what we're looking for is an increase in heart rate of 30 beats per minute in people who are 18 and older. So that's 30 beats per minute within 10 minutes of standing or 10 minutes of a tilt table test. In younger individuals, so 17 and younger, we're looking for at least a 40 beat per minute increase in heart rate with standing. Other things that we're looking for on the diagnostic criteria for POTS, so patients should not have orthostatic hypotension. Patients should have postural symptoms, and in addition to having that 30 beat per minute increase in heart rate. The presence of postural symptoms is important because some people do have an increase in heart rate with standing, but do not necessarily always have postural symptoms. So that history of having symptoms that are present with standing that then get better when they sit or lay down is critical in establishing a diagnosis of POTS. From there, we'll typically proceed with a basic laboratory evaluation. So we'll often perform a complete blood count to make sure that people are not anemic, to make sure that thyroid studies are normal. We'll sometimes check basic vitamin levels like vitamin B12 and folate, particularly if people are having a lot of GI symptoms that may impact vitamin absorption. If people are having postural lightheadedness type symptoms, heart racing type symptoms, or a history of syncope or near syncope, we'll typically ask for patients or have patients undergo an EKG and an echocardiogram to evaluate and make sure that the heart is structurally and electrically normal. From there, once the diagnosis has been established, once we've made certain that there isn't anything else going on that is not POTS that requires a different form of management, then we'll turn our attention to treatment. And with treatment, there are really two large groups of treatment. So there are conservative lifestyle measures, non-pharmacologic measures, and then there's pharmacotherapy to manage POTS patients. All POTS patients should be counseled on lifestyle measures to help improve and manage their symptoms. Lifestyle measures are critically important. I tell patients it doesn't matter what medication I prescribe for you. If you're not engaging in the lifestyle measures, then those medications are not likely to be effective or optimally effective. So the lifestyle measures, there's 6 things that we recommend that patients do. So again, this is lifestyle measures that requires the patients to be actively engaged on a daily basis. So we ask for, number 1, patients to increase their salt intake. And so the goal there is to get in 10 grams of salt a day through their diet, through drinking fluids that contain sodium. Some patients may report difficulty in getting that in through their diet, so some people may be able to use salt tablets to increase their sodium intake. We ask for patients to get in 2.5 liters of fluid a day, and we ask for 1/3 to 1/2 of this fluid to contain sodium. And so the salt in the fluid helps to expand blood volume, and the goal of that is to stabilize heart rate and blood pressure. From there, we ask for patients to engage in an active exercise regimen. So exercise is hard in POTS patients. Many patients, or most patients, will report a history of exercise intolerance. So exercise is difficult for people. We ask them to start slow with aerobic exercise. We'll often ask them to start on a recumbent bike or even a rowing machine with sitting down exercise, starting slow and gradual and ultimately building that up to 30 minutes or more a day of exercise. We also, though, ask for people to strengthen leg and abdominal muscles to reduce the amount of venous pooling that occurs when people stand or move around, and so that can be helpful in reducing symptoms of orthostatic intolerance. The other lifestyle measures that we ask for patients to initiate once the diagnosis has been established is to use compression devices. So we'll ask patients to use compression socks, compression tights, in some instances an abdominal binder, which is a wrap around the abdomen. And the purpose of the compression is to reduce venous pooling in the legs and abdomen with a position change. Again, that's helpful in reducing symptoms of orthostatic intolerance. The final lifestyle measure that we'll ask for patients to at least try is to elevate the head of the bed 4 to 6 inches, and we think that this may be helpful in reducing autonomic instability nocturnally. So those are the lifestyle measures, again, critically important. We ask for patients to get those fully engaged, and some people do respond very favorably to lifestyle measures, and not everybody requires pharmacotherapy to improve in terms of their POTS symptoms. But in people who have more significant symptoms or who aren't responding to lifestyle measures, we then consider pharmacotherapeutic options. And there are a number of things in the armamentarium for POTS, and what we decide to use is we try to tailor as best as possible to what the patient looks like from a heart rate and a blood pressure standpoint. So for example, in someone who has really fast heart rates, has a tachycardia that's very prominent, that's really bothering the patient, perhaps they have palpitations as well, then a low-dose beta blocker can be used. So we'll typically use something like propranolol or metoprolol at a very low dose to try to improve that tachycardia, to try to improve their orthostatic intolerance. We will sometimes use midodrine, which is an alpha agonist. So what that does is it acts to stabilize blood pressure. So many patients with POTS and other forms of autonomic dysfunction have blood pressure instability with standing. And so by using midodrine, that helps to stabilize the blood pressure, and then that can lower the degree of tachycardia in some patients. So those tend to be the mainstays of therapy in POTS patients. There are a number of other things that are available and can be used to help treat patients with more difficult symptoms.